I mentioned better ways to compare images. So I want you to look at these two images, and I'm coming to the end of the presentation, by the way, and tell me how many differences there are between the image on the left and the right. Now, recognize that even in the time that this slide has been up, on average, a radiologist in the US would have had to have looked at 20 or 50 different images. But right now, you're just comparing two images, and they're side by side. And the question is, when are you done? How many findings did you see? Well, you can change the way this information is presented to make good radiologists better. Simple. Take the images, you don't superimpose them, you flicker them, meaning there's no subtraction method used, but the images are placed in the same field of view in your retinas, and you flicker between the two images. Suddenly you become a motion detector, and as an animal, we're better. Particularly primates, we're way better motion detectors than we are able to do this sort of side-by-side analysis that we've been doing since Röntgen, discovered the X-ray. Same thing here, chest X-ray, chest CT, images side by side. See a nodule here? Is it bigger? Is it smaller? Do you pull out a ruler? Do you try to subtract them? You take those same images and you report them this way. I think you can say with confidence that this lesion here hasn't changed. You'll find another lesion up here, and you may even see the gorilla waving at you in the lingula. Chest X-rays, we've been looking at chest X-rays side by side, again, since Röntgen. Wouldn't we be better off looking at them this way? Even if they're not perfectly registered, the changes and the findings are easier to detect and faster. Mammography, we've been looking at them side by side with, 6, 8, 10 different hanging protocols for every case. Isn't it better if you can flicker between them? See the lesion jumping off the page, even though the images are not registered or not fully registered, they're partially registered. So I hope you've gotten some food for thought out of this presentation. I'm going to open it up for questions right now, and thank you for your attention.